10, so out. Great, right on time. Welcome for joining us on our first webinar of 2024. Although we started the all cohort year and started some activities, thank you for those of you who joined us. And Daniela had the writing retreat. And then this is our webinar that we are hosting. We did see some folks at the Dissemination and Implementation Science CPCRN get together as well. And so beyond this, we have our virtual meeting as a reminder tomorrow afternoon for the East Coast time. And then we will be having a few different webinars. I think we have one planned on community engagement, and another one planned TBA time, of course, on grant writing. Today, I'm going to invite you to join us on a professional development journey webinar. So we have 3 great CPCRN colleagues / researchers who are going to be talking a little bit about their backgrounds and sharing some tips and insights into professional development. Swann A, Stephanie Wheeler, and Elaine Morrato. And I am introducing each of them and letting them talk. And I do want us to see each other. So I'm going to do this quick overview and then stop sharing so that you could just have this as more conversational. But the topics we're going to cover are getting them kind of situated and letting us know a little bit about them. So I asked them to prepare some bullets about their journey. What training did they have? What jobs they want to highlight? How did they get into implementation science? Because I know not all of us started right in that area. And we have more and more scholars joining. The second one is any mentoring advice that they want to share with you, either from a mentor or mentee perspective. And the third question that I'm going to ask is, how do they stay current, contemporary? Where are the resources they go to? Who do they talk to? What do they see? So those are some of the things that I have planned. And then I'm going to let you all and others kind of just join into the conversation and ask your questions. So I am going to stop share that here. And I thought first that I would start off so this is a random order in terms of doing introductions, and then maybe we will get you to start talking about your career background and trajectory. So Elaine Morrato, she's a professor and founding dean of the Parkinson School of Health Sciences and Public Health at Loyola University in Chicago. She directs multi-institutional NIH-supported clinical and translation science program led by the University of Chicago and Rush University, and also focuses on issues related to health equity. She's trained in epidemiology and is board certified in public health. And her research focuses on accelerating the translation of health innovations into practice with a special emphasis on drug safety. She's worked with the FDA in their Office of Surveillance and Epidemiology and in industry commercialization in terms of new drugs and indication. And that's her kind of implementation science focus. So Elaine, do you want to get us started?
Oh, okay. I thought you were going to introduce the panel. So do you want me to talk about my career trajectory then?
Yeah.
This one? Okay. Welcome, everyone. There is no correct career trajectory, and I think that's what you're going to hear. Everyone is on a life journey, and it's almost like when you do square dancing, and what is it, the Virginia reel, where you're going hand to hand. And so I kind of think of my career as I follow my curiosity and stay open where it might go. So my first half of my career, as Cam said, I worked in industry. I worked at Procter & Gamble, which is a leading consumer product company. You probably have one of their products in your cabinet somewhere. And I joined their healthcare division and worked on developing new pharmaceutical drugs and new over-the-counter medicines. And my area that attracted me is I've always been interested in interdiscipline team science, we might call it. And so I had an undergraduate in biochemistry, but I was always intrigued with marketing and communications. And so I got to work as a product development person that partnered with brand managers and marketers. And so what evidence do you need to convince people to adopt or to make a compelling product that has value or perceived value, et cetera? And so I got a lot of great experience in an applied setting, and I realized I needed to go on after 15 years. If I want to be a leader in health, I need a doctoral degree. And so I never could figure out what's the doctoral degree Elaine wants to focus on, because I loved everything. And that's when I found public health. And I got first my MPH, and I said, I'm enjoying this so much, I'm going to do a DrPH, because it allowed me to still stay very interdisciplinary. I could take electives in different areas. And we might talk about this, about finding mentorship. I used a network to do my dissertation, and I found someone at FDA. I was intrigued about drug safety and how we think about promoting the adoption or diffusion of new safe use behaviors, the same way we think about promoting buying a new product. And how can we take the learning from buying a new product to inform these other, what we might call more public health types of behaviors? Our family moved, and we moved from an area where there was industry to Colorado, where they do not have pharmaceutical industry. So I had to reinvent myself. And I looked at what was available, and there was the University of Colorado. And I looked at where did I fit in, and that was in health outcomes research. And as time went on, that was the area or discipline that started to take on implementation science. So now I could talk about all of my commercialization experience and reframe myself as it's really implementation. Advertising is a form of dissemination. Marketing is a form of implementation strategies. And so where I get my excitement is at scale, and really thinking about how you scale up and sustain. That's kind of the business side of me. And if I think about what I'm doing today, I'm founding a new school, and that is a very large program to implement. And I'm getting to use a lot of the things that you learn in implementation and now apply it at a more organizational level. So there's a through line there. I didn't know I was an implementation scientist. My dissertation, I focused on diffusion of innovation theory. I've just kind of stuck with that, and sort of this one foot in, here's how the business side might approach the problem, and then the other foot in how a public health sector might approach. And I've over time enjoyed kind of that cross learning. That's my journey.
Great. Thank you, Elaine. I really love how, marketing is, as you said, dissemination, and how you kind of did the reverse. You kind of worked in that sector and then came into public health.
Yeah.
Thank you for sharing your story.
Sure.
So our next person is Dr. Swann A. She's a professor of epidemiology and biostatics at the College of Nursing and at the University of Colorado, where she's been for over 20 years. She has a deep understanding of research study design, research biases, and applied analytic methods. Most of her work has been conducted using a CBPR, or community-based participatory research approach, and she has partnered with African-American members to enhance the relevance and impacts of her work. Her research focuses on understanding the determinants of cancer health disparities experienced by African Americans and ways to intervene to improve their health and address inequalities. She has grant funding from NCI, the National Cancer Institute, CDC, and the South Carolina Cancer Alliance, in addition to the South Carolina Cancer Center. So, Swann, tell us a little bit about your journey. What would you like to share?
Hello, everyone. Good to see you. So first off, my apologies. Today is my first day of my teenage son driving by himself. And I, was like, Anderson, I'm like, are you okay? And he's fine, know quite how to get gas. So yes, this is my son, who is probably more brilliant than all the rest of the family combined, but can't find his way out of a paper bag. So, so sorry about that. But I think if anything, my journey is almost about somewhat what not to do. And but I have luckily ended up in a really good spot. So, you know, undergrad, I went to small liberal arts college, majored in biology, thought I was going to go to med school. And when I didn't get accepted, it was like, oh, what do I do now with myself? So I just kind of closed my eyes and on the bulletin board and like, where am I gonna, what am I, I'm gonna get a master's somewhere. So I ended up getting my master's biomedical science. It seemed like a good fit, you know, medical. I was like, I can do this. So I did that, and it was all in genetics, rat models, bench science driven. And I realized very quickly, no, this is not for me. So I was in a PhD program and then opted for an MS. And so then I was like, okay, now we're going to get some field experience. So I began working in pharmaceuticals and in the medical offices doing a lot of clinical trials, and eventually went into transplantation medicine, bone marrow transplant, and they had a really rich research program here locally in Columbia. And I just loved it and realized that I love to do research. I love to crunch numbers. And so a friend of mine was in epidemiology. She's like, you really should check out epidemiology. And I'm like, this is for me. So that's when I started a PhD then. And my advisor and mentor is actually on this as well, Dr. James A. Bear. And so, so got my doctorate and opted, because I had all this field experience and a lot of contacts in Columbia, opted to stay and have been at the university ever since, kind of growing and developing. And I guess I've always, you know, from my experience, have enjoyed the field work. I love the, I'm kind of, I guess, bipolar in some sense, because I like the data work. I like the number crunching, and really what I most love is, you know, we can use data to support decisions. And so what makes a difference? What's significant? But I don't like just being behind a computer. I need that touching base with people and to know that it's having impact. And so that field perspective is really critical for me. And that's probably what has been some of the most driving passions in my work, and really cemented my journey into more D&I stuff. I can say that I have never been formally trained in D&I at all. So y'all probably know more than I do, but I've had some fabulous mentorship in Dr. John Morrato was one of the first, and he recently passed away, and we had just some memories with him. And it was just, you know, he was very influential. Dr. Heather Brandt was a part of that as well. Really taught me what CPPR means, and through that got into more D&I. So more recently, there's been Daniela. So I've always been kind of this data-driven person who has wanted to implement on a wide scale. So I can say through my mentor as well, I kind of got the lifestyle intervention piece. You know, did work in physical activity and diet, and, you know, have that influence on how much they can change and influence health. So so that's kind of been, you know, more recently in my appointment at the College of Nursing, I've really begun to value that nurses, that field in general, is really on the front line, especially as we have shortages in providers that nurses can fill. And I really am excited about engaging more with the nursing profession as part of our way of implementing on a wider scale. So I've kind of gotten, you know, combined this. So a lot of, guess I should say, a lot of my journey has been about seeing opportunities as they emerge and getting in and working with good people and people that I admire in order to you know, follow that direction that it led. So that's me in a nutshell.
Thank you so much, Dr. Adams. I really love that. I mean, you've had eclectic, lots of different topics that you mentioned, and then you threw in some threads of mentoring and recognizing folks. So hopefully you can come back to that in a little bit. And so our last panelist is Dr. Stephanie Wheeler, who probably doesn't need any introductions because she's our coordinating center PI. But I really love the volunteer aspect of this because we couldn't have gotten more diverse training. So Dr. Wheeler is trained as a health services researcher, and she's a dissension scientist, which I've only really come to understand more recently, Stephanie. She focuses on social, behavioral, clinical, and organizational factors that affect healthcare access, quality, value, and also equity. Her research portfolio focuses on cancer care delivery, emphasizing improving value, understanding financial and psychosocial impacts on cancer, and also reducing health disparities. She's a methodological source for simulation modeling and system science, and also works on big data disparities. She has many different NCI-funded initiatives. Some focus on colorectal cancer, some focus on optimizing adherence for breast cancer survivors, and also on financial navigation and HPV vaccine. And she is the director of the Office of Community Health Outreach with the UNC Lamberger Comprehensive Cancer Center, to name a few things that she does. So welcome, Stephanie.
Thank you, Cam. I realize I should have cut down my bio because I think you covered a lot of the things that I'm doing. So I won't describe any of the current stuff since you did that so beautifully. And we'll just talk about kind of how I got here, which is not unlike Elaine's and Swann's experience in that I would say it was totally unexpected what my trajectory would end up being. And I never could have predicted when I was an undergrad or, even in my master's program that I would be here and that I would be focused on the research that I'm doing now. So I grew up in South Carolina, and most of my family lived in a very rural part of South Carolina, in the upstate, which my South Carolina colleagues will know. And no one in my family was an academic. My parents didn't have 4-year degrees or didn't go to grad school. So I didn't have a lot of familial role models for what a research career could look like. But I was really fortunate, like both of my co-panelists, to have excellent mentorship. And I think if there was one kind of golden thread that I would weave through my entire story, it is the power of strong mentors and sponsors who recognize talent and who work to develop that talent in lots of different ways. And those mentors, unbeknownst to me at the time, saw something that even I didn't see and encouraged me to pursue really unique opportunities and things that sometimes I didn't even know about until these folks brought them to me. And I think that, really determined my trajectory in somewhat serendipitous and opportunistic ways. But it was absolutely fundamental to kind of where I landed. So I went to the College of Charleston in South Carolina, so a public institution, and was part of the Honors College there. And like Swann, majored in biology and envisioned myself going on to medical school. And, I think that could have been a path, except that I really loved math way more than I loved being in a lab. And I spent 2 years, I think, maybe more, in the molecular biology labs at the College of Charleston and the Medical University of South Carolina. And I was, pipetting and running Western blots and doing all this science completely in isolation in like a dark room at night, having to check on my experiments at all times of the night and weekends. And I'm just a people person. Like, I'm a total extrovert. That did not work for me, to be so isolated and to feel like, one small thing, like you pipette, 1 mil less than you should, and the whole experiment has failed. That was not very rewarding. But I was fortunate through the Honors College to have access to the academic advising staff, who really was encouraging folks to think about postgraduate opportunities and to not immediately submit those med school applications and pharmacy applications and dental school applications, but to take a pause and think about, a gap year or think about other opportunities. And, that was incredible advice in my experience. So one of the things that they encouraged was writing Fulbright applications or Rotary applications. And there's a lot of other types of postgraduate applications that can enable folks to do research. And so I did that. I wrote an application to study immunology and HIV in South Africa, which I was going to do a master's of public health and study immunology, which was the connectivity to the lab that I was working in. But I didn't have that public health, that social science component. And I thought that would be really helpful to understanding what was happening with patients, you know, who are being treated for immunological disease. So I was very fortunate to be awarded that fellowship. And then once I got to South Africa and discovered public health for the first time, it was like my eyes were completely open to the rest of the world. And I saw a lot of things there that were not working as intended. And a lot of policies that had been passed and laws that had been put in place that didn't have appropriate financing, didn't have appropriate implementation plans, and didn't really have a focus on scale, despite like really incredible organizations and scientists working on the ground floor. So I think that was my first exposure to like the importance of implementation and the importance of thinking through care delivery. I spent almost 2 years in South Africa, and after I did my master's, I never even thought about medical school again. I just like went into a doctoral program a couple of years later at UNC, and my master's had been very focused on epi. So for my doctoral training, I wanted to get economics experience. And so when Cam talks about me being a decision scientist, the way that I sometimes refer to it is being an epiconomist. I have one foot in both worlds, in epidemiology and another foot in economics. And that's been a really helpful training to understand both the distribution and the determinants of disease on the epi side, but to really understand the financing and healthcare system organization and the structure that determines how and when and under which circumstances things can get implemented and what resource limitations there might be. So that's kind of the training background. And then I think, you know, the rest is history. I decided to stay in academics and took a faculty position here at UNC, where I've been ever since. And once again, was fortunate to have great mentors like Brian Weiner, who encouraged me to do the NT-DIRC training that was based at WashU in St. Louis. And so that was, I guess, my formal exposure to implementation science. And now, you know, I continue to work on way more things than, way more different topics than probably a good academic should. We're supposed to be very narrowly focused. I have a hard time with that. But it's been a lot of fun. And I love the flexibility that the academic world provides us. I'll stop there.
Thank you, Stephanie. I really love how you all have said that in some ways your journey has been circuitous or serendipitous. It's not like you came in wanting to do cancer control and or implementation science. So it's nice to kind of see your different stories. The next kind of area we wanted, and some of you have mentioned it before, so I'll let you all jump in with whatever you want to share around the importance of mentoring advice, being a good mentee, anything that you'd like to share with our group related to that.
I'm going to just start with one and thinking of it as I reflect on my life. Think of mentors as a family of mentors or a team of mentors. You don't have to find the one mentor that meets all needs, right? You know, so just like if you're in a family, you might go to your uncle for this or your brother for that or your grandma for this. You might think of reflect on what are the areas, you know, that you might need mentoring in. Sometimes that's a research method. Sometimes it's a content area. Let's say sometimes it's sometimes you have to make bridges outside of your organization because the area you're focused on is not a focus necessarily in where you are situated. And so that means you have to think about mentors that might be at other institutions. And I think that's one of the things that's really nice about the CPCRN is you're getting introduced into a natural network. You're not having to establish the network. You can take advantage of the network. And so be bold in that. And I'll just say one on that. My area of specialization is I look at the implementation of boxed warnings and risk management programs that agencies like FDA require pharmaceutical companies to implement and deliver. there's not many folks that specialize at that intersection of epidemiology, surveillance, and implementation science. So sometimes it can feel lonely and you go, gosh, am I in the right area? But what I did is I was at a meeting and I heard my early work was in antipsychotics. They have diabetes and cardiometabolic risk. And I was at a CME course and I heard a psychiatrist who was focused on this at a different university, in this case, WashU. He cared very passionately about the clinical topic and had interest in the policy, but I had the data and the interest in the implementation of the work. And so I just did a cold call. Are you interested in collaborating? I have this body of information that you might be interested in. And that established a really fantastic collaboration that lasted 10 years and it evolved. And if I hadn't just taken the risk with an email, it would never have happened. And so sometimes you be bold. It does not have to be a mentor where you are. You can use your network to say, you know, who has an interest in an area I'm interested in. And usually people in academics are energized by that interest focus area and are not constrained by it has to be, you know, in my physical location. And now post-pandemic, we're even more comfortable in these kinds of, you know, virtual mentoring and collaborations. So those would be some thoughts I want to share.
Great. Stephanie, you
I
were
think
going to
that's
chime in?
Yeah, well, first of all, I think Elaine's points are super spot on and completely agree with all of those. The other thing I will add is that I think the fit is incredibly important. And a lot of times you don't recognize the agency that you have in selecting an appropriate mentor and being really intentional about if it's not a good fit, taking action to find and identify somebody else. Our department has been really good, I think, about setting up sort of a no-fault environment whereby if students, you know, have been assigned an advisor or mentor and it's not working out, like anybody at any time can say, like, this is, you know, we just need to try something else and go with something else. And that's true for our faculty too. We have a formal mentoring program for junior faculty. And it's a very open and inclusive process. And it recognizes that like people need different things at different times. Just like Elaine said, you shouldn't expect to have a single mentor who can fulfill all of your methodological and content area and professional development needs. Most of us need some sort of mosaic mentoring, and that continues to evolve over your lifetime. And I think most people probably should aim to accumulate hundreds of mentors in your lifetime, and they're not limited to just your professional sphere. I have life mentors that I look up to as I think about how to be a parent of 4 kids and do this crazy job at the same time. So, you know, it's almost like a philosophy of learning from others and then paying it forward that is really important. And there have been situations where I've been given bad advice by a mentor who I loved dearly and knew that they had my best interest in mind, but I knew that that was not the right advice. And our relationship continued anyway. And it was a beautiful relationship. And I've had situations where it just wasn't a good fit for whatever reason. And I've successfully been able to navigate out of those and find what I needed elsewhere. So I think the moral story is don't get stuck. And, you know, you are your own best agent. You are your own best advocate. And keeping that first and foremost is really important, even if you're a student, you know, that you have an ability to do that. And that's one of the things I hope the network can do is offer mentorship from, you know, all of these incredible people all over the country who've been through it and seen different models of it and can help.
So I just want to, you know, really strongly agree with what Elaine and Stephanie have said before. The only other things that I might add would be, and I think Elaine touched, both of them have touched on this, but you know, not only have I really benefited from more senior members, I've also benefited from peer mentors. And, you know, I mentioned Heather Brandt, Daniela Friedman have been a part of people who have really influenced my life and influenced my career trajectory and to see how they do things. So I think that like, you know, kind of at all levels and all walks of life. The other thing that I think is really important, both for me as a mentee, as well as me as a mentor, is to bring that holistic approach. And and realizing that some people are more comfortable with that than others. So like in the case with me as a mentee, there may be people that I don't talk about my personal life with that I would talk about with other people. Sue Heine, who's also part of this network, was one of those that really helped when I had young children and was promoting through the system. She was, how do I manage that? So I think that was invaluable. And at the same time, coming from the other, with my mentees, I want to be available in that space and be real in that space. So a lot of times I'll talk about my own struggles and my own kind of things that I've learned along the way and all that stuff, and invite my mentees to share as much as they want. But I respect too. I would also want to say I definitely respect if people don't want to share that level with somebody. But I think through that, it's really that's what sustained me long term in this field. I think that we have a high burnout rate in public health because you give it your all, and then you're just like, I've given too much. And I think by really making those connections with people and really gravitating to those connections that make, and those mentoring relationships that make you feel good, that build you up, both from you helping someone else as well as someone helping you. And I think there's that bi-directionality of any relationship that's critical. So
yeah, I wanted to build on what you're saying there about the bi-directional. Think about what's the value as a mentee you can provide your mentor. And it is a human relationship, right? And so sometimes it's easy to frame it as, what do I get out of it? But also think about that your mentor is trying to navigate their own career. So how might you approach it in a way that's also beneficial to them? So what does that mean? If your mentor is someone in academics moving up rank, publications are important, right? Being able to be part of publications and to say, I have a mentee on my publication has value in our academic environment. So as a mentee, completing a publication is very highly valued, so just be aware that, it is two-way, like you're saying, Swann, and like with anything, you've got to think also the value you're contributing to the relationship. And then I wanted to echo what Stephanie was saying, I think a little bit as well, is that it's a lifelong evergreening process too. And you're going to expect that your very best mentor may have lasted, like the one I mentioned, 10 years. But you know what? Our careers kind of diverged. His area of interest didn't intersect with mine. And it's okay to sunset that or take it into a new direction. So as time goes on, you think of it as an evergreening process, right? As opposed to only the start process. Think about the sunsetting in a way that you want to, as you were saying, Stephanie, how you navigate out with grace, because we're all humans too, and that's important, I think, too, in this.
Great, thank you all. And I think it's nice that you built on each other. And I like the focus too on the non-professional type mentoring, whether it's kids, relationships, where should I go? Should I move or transition to this new job? I think all of those are important as the professional ones, as you were mentioning. So this last area, not all of you have to answer it, but how do you stay current? What are things that you look for? Or things that you join to keep up with the field or keep up with what you want to keep up with in terms of your skill set?
Well, you join CPCRN, of course. Jokes aside, I think this is really hard, to be perfectly honest. I used to feel like I could do a pretty good job keeping tabs on the literature through being on listservs and being on Twitter. But as we know, Twitter seems to be imploding and a lot of academics are leaving it altogether, although there's still a lot of great scientific content, X, on X. And then with the listserv thing, I don't know about y'all, but I get so many emails, like the volume of emails is so extreme that I can't even read them, much less answer them, much less try to identify, where the best where the best articles are coming from. So for me right now, what it has meant is choosing a couple of key journals that I follow pretty regularly and skimming their tables of contents and making sure I am kind of keeping track of what these key journals are publishing in my area, but also conferences. I mean, to me, that is a really efficient way to learn what's happening on the cutting edge, since most of the stuff that's presented at conferences hasn't yet been published. So you give a little bit of an inside view. I think the D&I conference is an excellent example of that. For me as a health services researcher, Academy Health is another one. And then I do a lot of work in cancer outcomes and care delivery. So the ASCO quality of care meeting is great, as is the American Society for Preventive Oncology. But we all have different meetings for our different disciplines. And for me, that's probably the most efficient way that I can absorb a lot of information at one time. But I'm really excited to hear what Elaine and Swann have to say about this.
So I agree with Stephanie. Probably the best way for me has been through conference attendance. And I have to say that with my children and being young and involved in their lives, I actually have stopped traveling as much as probably as I did prior to children. So I think if there's anything that's my weak spot, it's in keeping up. But one other way that I've found that it's really useful or really helpful in keeping up with is being a part of multidisciplinary teams and, really learning from other colleagues who are outside of what you normally do has really been key to see what is innovation there and how can it come into, the world of cancer or vice versa. Really has been, and I enjoy the connection, the interaction with colleagues as well. I just find that very intellectually stimulating. So that's been my other way of keeping abreast.
Yeah. So diffusion of innovation theory says actually early adopters and innovators are the ones that are more likely to go to these kinds of conferences and to engage like that. So it is an efficient way because other innovative thinkers aggregate in these same settings. So you really are sort of at the early tail of something new coming on. You'll hear it first in these, and it gets delivered in a way that's more human to human. Than I agree with the email burnout. There's only so much you can absorb. If you're at a university, I have found when I taught, at least in that class area, it forced me to stay up to date. And so that there's a lot of benefits. So not all of you will be in those kinds of professions, and some of you might consider teaching a drain, but doing things like teaching or reviewing articles, or as you get more senior, sitting on study sections, these are service kinds of things. I have found a real efficient way because you're seeing how others are digesting information. And that I found useful. We work in public health and policy settings. So I have found following resources as well that are like Kaiser Family Foundation, or depending on your specialty, there might be other outside groups that are following the policy in your particular area. So if you follow them, they are digesting, those journalists are digesting the information and then packaging it. And so that's another efficient way to stay up to date, is to find which, if you're working in a state organization, it might be what, the associations of states and territories in health, following, those news policy briefs will keep you up to date. I follow Medscape or MedPage or whatever it is now. They're digesting key articles. They're digesting what's going on in the governmental stage that relates to the policy area of interest. And so, supplement, I would recommend that as well to the traditional, science articles and meetings.
Great.
And also, I'll just add, if you are a mentor for a mentee, your mentee is a great resource in helping you stay up to date, because they're at that moment of, if you're a graduate student, active aggregating of information. And so that's actually a value you're giving your mentor, is helping them stay current in a way that feels fun, as opposed to, let me just read another email listserv opportunity.
Great. I like that last point, Elaine. Well, I've learned a little bit something from my three colleagues that I haven't known before. So I also want to let our scholars ask questions, or even other people on our panel ask questions of each other related to professional development. What would you like to know regarding career mentoring, next steps that you'd like to ask them? You can either type it into the chat, and then Allie, Courtney, and I might be able to read it out loud, or if you want to just come off mute and ask a question, that's totally fine as well. Who wants to be our first taker?
Well, while we're waiting for a question, can we ask you, how do you stay current?
I actually agree with you. Local to regional to national conferences are some of the ways that all of us can stay current. We know that it takes, oh my gosh, 6 to 9 months to a year to publish an article. So if you're waiting for the latest science, it's already dated by the time you read it in the print or e-journals. And also people like to share work or preliminary things at conferences. And then the other way that I like to stay current is, I think Elaine, you alluded to it, and Swann too, the team science is, as I work on different projects and we're coming together, writing the grant or updating the literature review or doing our formative research, we're kind of helping each other stay fresh in what we need to know related to our field, related to that interdisciplinary work as well. So don't forget to, have part of your team meetings not just be about the practice of doing your work, but also, having each other present on, our component of what we're contributing to that team science. And I enjoy that too. And I feel like we have less meeting times for that because everybody wants to move on the practice and implementation area. So thank you.
I do have a question if there's time. Okay, I have a question with respect to something Stephanie you mentioned, the tendency to not always feel like your academic interests are very focused and narrow, and building yourself as an expert in a specific space and building your niche. That's been feedback I've been getting at my cancer center. I call myself a health disparities researcher, so that falls into so many buckets. And I also think about the intersection of cancer and other comorbid conditions, and sometimes that turns into a gray area. So I was just wondering if you have any pearls of wisdom for someone who has a similar issue, I guess, or place of feedback that I've consistently received that I need to narrow, I need to focus, I need to be known for one specific thing, which I haven't, I guess, achieved yet based on my mentor's feedback at Moffitt.
Oh my goodness, Jessica, we should talk more because this is, I think, an ongoing challenge, because I think the incentives are set up to actually advantage people who have a lot of different interests, because if our funding lines are less than 10% for most of the grants we apply to, you've got to write 10 to get one funded. And if you're lucky, right? And so you've got to be somewhat diverse in the way that you approach grant writing if your salary and your position is expecting you to be grant writing. And yours is, and I think any of us in research active positions are constantly thinking about strategy, and so if there's a new RFA that hits the street that has a focus in a specific way, you start to think, well, is there something I can do that I can respond to this and take it into a direction that is aligned with my work, but also a little bit different? I think that's very natural, and that's a very reasonable response. And where it becomes an issue, there's two places where I see it becomes an issue. One's you get overcommitted because and spread too thin. And I know you're so talented, and you're going to continue to do that when you're successful, and then you end up on 10 different grants, and then your headspace, it's hard to focus. You're going from study to study to study, and they're all on different things, which comes back to the earlier question about how do you stay on top of the literature if you are studying HIV and HPV and cancer. That's where it becomes hard, is when you start to, the problem of overcommitment that we all have, I think is a more challenging problem when you're spread across so many different types of topics. That focus becomes a challenge. The other place I see it becoming an issue is at the point of going up for tenure or promotion, whatever type of institution you're in, but particularly around the tenure and promotion in academic environments, you're expected to articulate like a line of programmatic research that is compelling and very narrow. And to me, that is a somewhat similar issue as to like grantsmanship, like telling your story and thinking through like the narrative way to tell your story, even if it means you can't tell them about all the cool stuff you're doing in Kenya or whatever, is the way to approach that, I think, because you need to make the mark and kind of get through your peer colleagues, internal process for tenure and promotion. And that's going to be really driven by, I think, whether you've been able to tell a clean story. And I think you can get lots of input and advice from people who've been through tenure and promotion who can assist with that. So that's where I see it coming up in my experience as a challenge. I would not discourage you, though, from having diverse interests, because I think if you're not passionate about the work you're doing, you're not going to be motivated to keep doing it. So while that might be different than prioritizing your time and setting boundaries, I have a problem with that too, by the way. I think it's a separate issue, like if you want to work on a lot of different things, I think to keep yourself going and to keep your energy high and your enthusiasm strong, I don't see an issue with that, as long as you're able to do it in a way that keeps you sane and that allows you to have a life outside of work. And that often means not necessarily constraining the topics that you love, but constraining the number of things that you're committing to instead. But we can keep talking if you'd like some other time too.
I would like to add to that, coming from public health and my academic appointment in nursing was, and so I was a junior faculty in nursing and was getting a lot. And this is a field that it's very risk aversive in the first place. I mean, and naturally so. These are people dealing with people's lives, and so are training to deal with life and death situations. So very risk aversive and very incremental in how they conceptualized a research career, so to speak. So I got lots of advice, like you're way too scattered too much, and you really need to focus on just little incremental grants, that go one step further in this line. And that was never going to be me. I was lucky because I also had mentors in public health that have a higher tolerance, if you will, for a little bit more diversity. So but I think what really got people's, you have to, I found that I had to first acknowledge that there was an element of truth in what they were saying, because, for all of us, there's a point to where you can be so dispersed, you're not getting anything done. And so, you kind of have to ask yourself, am I not getting anything done? But I think if you're having successes and you can point to those successes, that's how I dealt with it a lot with nursing. But, this is getting me this grant funding, which then could be leveraged for the next grant funding, and, and starting small and getting bigger. The same with publications, but this is, especially like for stuff around the CPCRN, this is a national group that you're, which is considered like when you're junior, kind of, the next level, so to speak. So that's another way that I kind of dealt with that. But I absolutely agree with Stephanie that when you, especially for tenure promotion, you've really got to be able to articulate, and I think it's possible. I think it's entirely possible to, and I've seen people who have a real gift for this. It's probably not me. So I've relied on some others, like Danielle is really good at that type of thing, but really helping to thread it and show it. And because there's always some unifying concepts that you can begin to incorporate within it all. So.
So if you stay academic, just know that this is, I think, rank and tenure guidance where different places are opening up to the area of team science and not having everyone have to always be the PI, but rather sometimes you might take a lead on the topic. Sometimes you might be a methodologist working with someone else. And so I think more rank and tenure are appreciating sort of that diversity of kind of research collaboration. So, depending where each of you are, really get to know what your rank and tenure, environment is. And then you can kind of play within that a little too, I think. And then it's a good practice to, like what you're hearing, you guys made me think, can you put, depending on where you were, when I went through, you had to have a 1-page on what is your scholarly story? What's your personal statement? So just practicing that early on, or even practicing how we each wrote our bios, is forcing you to think through, well, how would I describe my through line? And then use that. That's a good reflective piece, because you will, if you're successful, you will get asked to join others' projects, and then you have to learn what Stephanie was saying, which is saying no, and knowing when you have to evergreen and say, okay, I'm being successful in too many areas. I can't do it all. So how am I going to evergreen my portfolio of work? And so having a sense of what is your through line story from the beginning will help you kind of give you, I think, a touchstone as you march along. Maybe. And maybe
Another
it's
question.
disparities, like you were saying, so.
Yeah. And Jessica, I'm happy to talk to you about that too, because I have served as vice chair of research and have helped a lot of faculty talk about their story. So if you want to have some conversations.
Thank you. Awesome.
I have a question for the panelists. You guys have all mentioned keeping up to date at conferences, and I was wondering what is your methodology for going to conferences, since it is a fire hose of information? Like, what is your strategy? What is your style when you go to these conferences to mingle and also take in the new information?
That's a great question. I have found my style has changed as my career has progressed. Early on, I think my style was probably more narrowly focused on the area I was focused on and really being deep on that, right? So let's say I was doing antipsychotics and I cared about diabetes risk. I really made sure I went to conferences in that area, both American Diabetes or the psychiatric, and I was really very focused. And then I would go listen to the plenaries, and that would be nice. And if you're in a very large meeting, like American Diabetes and Cancer Day, they're usually giving the Lifetime Achievement Awards of something. And then those people have the invited lecture. So you can kind of, it's interesting to see how that large whole of their life has progressed. As I've moved on, you're going to find that, gosh, how much new stuff is really happening. There's like a steady state, and there's only so much innovation that's happening year over year. And so you probably, it's more validating what you know, and then you're looking out for those symposium or plenaries that are new topic areas that you haven't heard about, and then you're choosing those to keep yourself kind of current. And so, yeah, I've watched as how I attend evolves, and then I've spent more time connecting with people that I've now known and talking with them more about where they see the field going or issues, et cetera, as opposed to doing all of the learning by going to like the poster session exclusively. I mean, yeah, you try to hit it all, but where I put my time has sort of evolved. I don't know how Swann and Stephanie, as you look at your attendance at these meetings.
Well, I think people get different things out of different conferences, and what people are looking for varies, as it should. I mean, some of us are going to, get the latest science. Others are going to have their social cup filled, others are going because there's professional opportunities. Often people are often hiring, and, at conferences, you can connect with those folks. There's all kinds of reasons and motivations. And the common refrain I heard when I was in my training is, you need to be networking and getting everyone's business card and following up on them. There's like all this pressure around professional networking at conferences. And as an extrovert, even I found that to be exhausting and like, I didn't want to do that with my time, and it felt very intimidating. So I don't think you have to do it the same way as everyone else does it, or whatever advice you may be given about how many business cards you should be exchanging at these things may not work for you. And a lot of folks, even at a conference, get exhausted and need to take some time back in their hotel room to like unwind and kind of absorb what they've learned. All of it is fine. That's what I would say. You make a conference what you need out of it and get what you need out of it. And all of that is good. For me personally, I tend to only go to conferences where I know the vast majority of the content is spot on the type of work that I do. I don't often go to conferences that are very highly specialized or that are so big like APHA that I can't find my people. And then when I'm there, I do some socializing. I do some of the big venues and the big keynotes, and I do the poster sessions, but I don't try to do it all. I take time to walk with Heather Brandt, or Heather should be here. She keeps getting brought up, but I just would say there's no only way to do it.
I just want to chime in with, both Elaine and Stephanie have mentioned this, and it's really, for me as a lot is the connection piece, and looking to, network some, but who do I feel that connection with, and who would inspire me in my, I want to extend and potentially collaborate with. So I really think about the connection, and I choose conferences based on that as well, like those that I find are more intimate. And the ACR Health Disparities is one of those that's really geared towards mentor-mentees, and I've really enjoyed that, and the connections that you can create there really, are inspirational. And I would say one final thing I want to bring, I copied into the chat a quote that actually was sent to me by Daniela. And there's a part of it that I really, that's really been life-changing in some ways. And that's saying no to spending time with uninspiring, critical, or negative people. And it's really, I do things now that inspire me and that I'm passionate about. And that always leads me I found that it always leads me in the direction that I need to go. So, as hokey as it can sound, follow your heart in a lot of ways and follow your instincts. What tells you is going to be a good, positive relationship.
What a great way to close this.
Yeah.
Swann.
Yeah, it's perfect.
Thank you so much for sharing that quote. And thank you all for sharing your wisdom throughout the different questions, and also being willing to share your personal emails in case people want to follow up. I hope you enjoyed this session. And of course, I know there are people that told us that they couldn't come, but would love to hear the recording. As Stephanie says, joining CPCRN is one of the ways for professional development, but there are many other insights or kernels of wisdoms that you heard today. Possibly let us know in some of your feedback if you like sessions like this. But we will take some of the other topics from the all cohort survey to kind of populate some of the upcoming webinars. And we look forward to seeing you all tomorrow for those of you who can make it. Any final words, Danielle, that you want to say? But thank you again to each of our panelists for sharing. And I learned something new about each of you.
Well, this was amazing. And thank you, Cam, for moderating, and to Allie and Courtney for organizing us so well. And while I knew about everybody, you all had connections that, like, I don't even know if you all knew. I didn't know. And I just thought that was incredible. So it was wonderful. Thank you.
Thank you all, and have a great evening or afternoon.
Bye, y'all.
Thank you.
Bye.